We are a relatively small program. We're 3 residents a year, 5 years total, so 15 residents. We actually have more faculty than residents currently, and that's part of a good thing. The residents get a breadth of real wide experience in terms of orthopedics. We have a very busy trauma service, we have a very busy sports service, we have joints, we have everything you could think of in terms of where you want to train. It's a small program, it's very close-knit, residents get along very well, which actually obviously helps, and quite a family feel.
What appealed to me was the early and excellent operative experience that all residents receive here, especially from our world-renowned surgeons, Dr. Savoy and Dr. Gladden, in the trauma and sports medicine specialties.
We rely on the resources of Tulane, obviously an outstanding institution. Tulane has 3 hospitals. University Medical Center is our trauma hospital, which we share with this other school in town. And then there's also some opportunities in the community, and some of our former residents have really taken the lead in helping our guys get an experience there. And that helps with learning how the different aspects of practice. We have a very, very academic practice, high-level research, high-level clinical, unique cases, and then we have some bread and butter community cases as well for the people who want more of the community feel.
It's a great mix between academics as well as some private guys that we work with. It's a great surgical experience, so you get to use your hands a lot, and you have a great clinical experience as well.
Typical week's busy, but I think that's why people sign on for residency in orthopedics at Tulane. We do a lot of cases. We always at the top end of what you should be doing for cases, which is good.
You get to have one-on-one experiences in the operating room with these surgeons and really learn a lot.
You're going to learn top-notch, cutting-edge orthopedics. Many of us teach from around the state to around the country to around the world. We teach both techniques as well as different products that are sought after by people literally around the world. So you're going to learn everything old, everything new. You're going to have an opportunity to see cases you may not see other places. We have a large referral service. People come in from different parts of the country to be treated by us because we have unique experiences. And as a result, you will get the day-to-day bread and butter orthopedics. In the trauma world, unfortunately, we have a very high penetrating gunshot wound community, so you'll learn a lot about that and the effects of that. We also still have a large amount of car accidents and things. You'll also learn a fair amount of that. Our sports department is one of the best in the world. They treat every athlete from little league to NFL or professional types, and as a result, you're going to experience in terms of dealing with sports at all levels and learn a lot from them as well.
I'm currently sitting in the orthopedic library at our downtown medical campus. As a 4th year, you get to continue your 2-month rotations on various subspecialties. I just came off sports medicine where I was working with Dr. Savoy, Dr. Hurd, Dr. O'Brien, and Dr. Mulcahy on a variety of sports cases, ranging from your bread and butter cases all the way to things much more complex.
We have a very, very productive chairman who is very well known in the research world. He allows us many opportunities, both within the academy and outside the academy, to get involved in research as well as exposure to orthopedics. Along that, we have several faculty members, including myself, who have an interest in research to the point where you can get involved in a numerous number of projects. New Orleans is kind of unique in the sense that things that happen here don't happen other places. So if nothing else, you'll probably find yourself in a pretty interesting case report on somebody who's done something rather unique to get injured or get ill. And you get an opportunity to take care of that person. Anyone who's been in New Orleans realizes it's a very, very unique culture, and the Tulane Orthopedic Residency mimics that.
This is a great place to be. You'll have the support here, you'll get your surgical experience, you'll get your clinical experience, and anything that you want to do afterwards. If you want to do a fellowship, I think we have a great track record with our residents getting the fellowships that they want, so it's definitely a place to be.
Every year our residents pretty much go to their top 1 or 2 choices in terms of fellowships. We have an outstanding group of alumni literally around the world at this point. That's one of our unique things about Tulane.
Also the camaraderie amongst our residents, where we enjoy time amongst each other outside of the hospital, and also the great relationship we have with our attendings that made me feel at home here in New Orleans.
We're looking for someone who wants to work hard. I mean, orthopedics is basically what you're signing on for, and that means you're going to work hard, but also wants a small group of people that they want to grow with and develop with, and on top of that, meet people from around the world. So we want people interested in research. We want people who are interested in a large amount of clinical volume. We want people who just want to help further their education while taking care of a group of people who really need them. Again, if you've ever been in New Orleans, we have a unique subset of people here who unfortunately don't always get great care. This is a tremendous opportunity inside the United States of America to take care of people who you are surprised are not getting good care. And so you have a unique opportunity to really make a difference here.
Somebody that's excited and eager to learn, somebody that's a team player that just wants to come and learn orthopedics. I think that's what we all are here for, is to learn and also to take care of patients. So if you have a big heart for taking care of patients, then Tulane Orthopaedics is a place for you to be.
Everybody has buildings, everyone has operating rooms, everyone has people who are injured. That's going to be any residency you find. What you'll find here that's unique is your co-residents, and when you get a chance to come here and see them, you'll know exactly what I mean.
Not only is New Orleans a great place to train, but it's also a great place to live. From the countless music festivals, all the delicious food to eat, the great sports.
I think we have an outstanding program. Tulane Orthopaedics is world renowned. We're looking for some more outstanding people to be part of that program, and we hope you give us a good look. It's very unique. As I mentioned, it's very diverse. It has a whole lot to offer, and I know you guys also have a whole lot to offer, and we hope you go and offer to us. So we hope you take a good look at us, and any questions or concerns, please don't hesitate to reach out.